What is
anesthesia? Anesthesia.
level, intermediate to advanced. Part of speech, noun. Field of use, medicine, specifically anesthesiology. Deconstruction, in, without, plus aesthesia, sensation. Origin. The word is derived from Greek, where, and means without, and aesthesis means sensation. Meaning. Anesthesia refers to a medical state induced for the purpose of surgical procedures or medical treatments, involving the loss of sensation, consciousness, or pain. Singular and plural. Anesthesia. Non-countable. Common sentence. The patient was given anesthesia before the surgery to ensure a painless and unconscious experience. Synonym. Sedation. Narcosis. Numbness. Antonym. Sensation. Awareness. Idioms. Put to sleep is sometimes used colloquially to describe the process of administering anesthesia. Derivatives. Anesthetic, an adjective used to describe something related to or causing anesthesia. Example. The anesthetic injection numbed the area before the surgery. Anesthetize, a verb that means to administer anesthesia or induce a state of insensitivity to pain. Example. The dentist will anesthetize the patient's gums before the extraction. Anesthesiologist, a noun referring to a medical professional who specializes in administering anesthesia. Example. The anesthesiologist monitored the patient's vital signs during the operation. Anesthetist, medical professional specializing in administering anesthesia during procedures. Example. The anesthetist ensured pain-free surgery for the patient using precise anesthesia techniques. What is the difference between the anesthesiologist and anesthetist? Anesthesiologist. Role. An anesthesiologist is a medical doctor, MD or DO, who specializes in anesthesia and perioperative medicine. Anesthetist. Role. An anesthetist is a broader term that can refer to a certified registered nurse anesthetist, CRNA, or an anesthesia assistant, AA. Education requires completion of medical school, typically 4 years, and a residency in anesthesiology, usually 4 years. Education CRNA, registered nurses with additional specialized training in anesthesia. They hold a master's degree or doctorate. AA, non-physician anesthesia providers with a bachelor's degree and specialized training. Responsibilities. Anesthesiologists are involved in preoperative assessment, planning anesthesia care, administering anesthesia, monitoring patients during surgery, and managing postoperative pain. Responsibilities. Both CRNAs and AAs work under the supervision of an anesthesiologist or a surgeon. They are involved in administering anesthesia, monitoring patients, and providing care during surgery. How many types of anesthesia? There are 3 main types of anesthesia. General anesthesia induces a reversible state of unconsciousness for the entire body. Example. The patient underwent general anesthesia for a complex surgical procedure on the heart. Regional anesthesia numbs a specific part of the body, often used for surgeries in a localized area. Example. During knee surgery, regional anesthesia numb only the lower limb, providing effective pain relief for the patient. Epidural. Epidural is a specific technique within regional anesthesia. It involves injecting anesthesia into the epidural space around the spinal cord to provide pain relief or numbness in a specific region, often the lower part of the body. While epidural is commonly associated with pain relief during childbirth, it is indeed a subtype or technique under the broader category of regional anesthesia. Local anesthesia temporarily blocks sensation in a small, specific area, such as during minor procedures. Example. The dentist applied local anesthesia to numb the area before extracting the tooth. Anesthetic agent, substance-inducing insensitivity to pain during medical procedures or surgeries. Example: propofol is a commonly used anesthetic agent for inducing and maintaining anesthesia. Lidocaine serves as a local anesthetic agent to numb the skin before a minor surgical procedure. Inhaled gases like sevoflurane act as anesthetic agents for maintaining anesthesia during surgeries. Narcotics, powerful analgesic drugs that relieve pain and induce a state of altered consciousness. Example: morphine is a narcotic used for postoperative pain management in hospitals. Anesthetic effect, loss of sensation or consciousness induced by administering anesthesia during medical procedures. Example: the anesthetic effect ensured painless dental surgery for the patient. Sedation, calming or inducing sleepiness using medication to manage anxiety or promote relaxation during medical procedures. Example: the patient underwent dental sedation for a relaxed and anxiety-free experience. Conscious sedation, medication-induced relaxation, allowing patients to respond to commands while undergoing medical procedures or surgeries. Example: conscious sedation allowed the patient to remain relaxed and cooperative during a dental procedure. What is the difference between the conscious sedation and sedation? Conscious sedation, a state of reduced consciousness, allowing patients to respond to verbal commands. Sedation, inducing a relaxed or sleepy state using medications. Commonly used in minor medical procedures or dental work. Can refer to various sedation levels, including conscious sedation and deeper levels of sedation. Example: administering medication to relax a patient during a colonoscopy while keeping them conscious. Example: providing sedation to ease anxiety and ensure comfort during a medical procedure or surgery. If someone asks me, "Have you had an anesthetic before?" how can I answer? There are several possible answers. Yes, I have had an anesthetic before. Follow-up questions. Do you remember which type of anesthesia was used? I don't recall the specific type, but the anesthesia provided effective pain relief during my surgery. How did you react to the anesthesia in the past? In the past, I reacted well to the anesthesia. I didn't experience any adverse effects or complications. No, I have never had an anesthetic before. Are you aware of any specific concerns or preferences regarding anesthesia? I don't have specific concerns, but I'd like to discuss the anesthesia plan in more detail. Do you have any family history of reactions to anesthesia? No family history of adverse reactions to anesthesia. I generally tolerate it well. I'm not sure if I've had an anesthetic before. Can you recall any medical procedures or surgeries where you might have received anesthesia? I had surgery where anesthesia might have been used. It's important to know for your safety. We can check your medical records to confirm. Sure, let's check my medical records to ensure accurate information for my safety. Commonly asked questions about anesthesia. Before surgery, what type of anesthesia will be used for my surgery? The anesthesiologist will determine the most suitable anesthesia based on the nature of the surgery and your medical history. Will I be completely unconscious with general anesthesia, or is there another option? General anesthesia renders you unconscious, but alternatives like regional or local anesthesia may be considered depending on the procedure. Are there any risks or side effects associated with the anesthesia you plan to administer? While complications are rare, the anesthesiologist will discuss potential risks and address any concerns you may have. Concerns about awareness: is there a chance I might wake up during the surgery with anesthesia? The anesthesiologist takes precautions to ensure you remain unconscious throughout the procedure, minimizing the risk of awareness. How does the anesthesiologist ensure I won't feel pain or be aware during the procedure? Anesthesia medications block pain signals to the brain, and monitoring equipment helps maintain the desired depth of sedation. Can I discuss my concerns about being unconscious with the anesthesiologist beforehand? Absolutely, it's important to communicate any concerns or fears with the anesthesiologist, who can address them and provide reassurance. Recovery and side effects. What can I expect in terms of recovery after being under anesthesia? Recovery times vary, but the effects of anesthesia typically wear off shortly after the procedure. You may feel groggy initially. Are there common side effects or lingering effects from anesthesia after the surgery? Common side effects include nausea, sore throat, or drowsiness. The anesthesiologist will manage these and monitor your recovery. How long does it typically take to fully recover from the effects of anesthesia? Most people recover within a few hours, but individual recovery times can vary. The medical team will ensure you are fully awake and stable before discharge. Alternatives and options. Are there alternative methods to general anesthesia for my surgery? Yes, alternatives like local or regional anesthesia may be considered based on the type and complexity of the surgery. Can I choose to have local anesthesia instead of general anesthesia for a specific procedure? In some cases, yes. The anesthesiologist will discuss the options and help you make an informed decision. What are the benefits and drawbacks of different types of anesthesia? Each type of anesthesia has its advantages and considerations. The anesthesiologist will explain these based on your specific case and preferences. Personalized concerns. I have a history of nausea after anesthesia. Can this be addressed or prevented? Yes, the medical team can take measures to minimize post-anesthesia nausea based on your history and preferences. How will anesthesia interact with my current medications or medical conditions? The anesthesiologist will review your medical history and medications to ensure a safe and tailored approach to anesthesia. Is there anything specific I should inform the anesthesiologist about my health or preferences? Any relevant health information, allergies, or personal preferences should be communicated to the anesthesiologist for personalized care and safety. Wishing you a smooth and comfortable experience with anesthesia.